here's another example of black and white. When I got out of the hospital, I think I went back for a checkup or something. I can't remember the timeline, but they were checking my INR levels because they had me on warfarin first.
Yep.
And they wanted you between 2 and 3. And so they checked my blood at the hospital in Spokane. I came home. They called me about 2.5 hours later and says, your level's at 8. Go to the emergency room right now. If you start bleeding, you're not going to stop. So, of course, I'm freaking out. And I had just taken another dose of warfarin because it's a nighttime medicine. I go to the emergency room in Ephrata. My level then was 8.9. They said, we can't touch you unless you're at a 9. Like 1 point.
I get it. I get it. We hear it all the time. Janet, do you want to discuss normal lab levels versus optimal levels?
Right. So, unfortunately, in our system today, we can't decide on a level of common sense that we're treating numbers, we're not treating patients, and labs are tools. It's no different than your surgery is a tool. Labs are tools to help us make decisions, but practicing medicine takes you to a different art level. And I'm flabbergasted sometimes when I hear that people can't be treated because their level is, it's almost there, but not quite.
Is that more about legal reasons for the hospital?
I think some of it can be legal, but Carl, honestly, I think some of it is that providers need to pay attention to what is actually happening for a patient, because what might be normal for one is not normal for somebody else. And that's when you have to look at your client and your patient and decide, do I intervene now or do I wait? That comes down to being a clinician. We can look at numbers all day long, but a number that's not the patient in front of us. There's many labs out there that, the normal range is large. If there's symptoms, if you are bleeding, treat. If you're that close, there's a point where we have to get over the number and actually take care of a patient, I guess, is where I am stuck with it, because many times throughout our training, we're taught, that number is just a snapshot in time. And that time lapse between, being safe and unsafe is maybe very short. So good thing that you were in the ER, but it's too bad that we have went to that extreme that, oh, no, I can't take care of that because it's right here. And that's...
Yeah, well, I'm sorry that happened to you, Carl. And unfortunately, that story is all too common. Here's what one of the reasons I think that happens is that doctors and healthcare providers, they let insurance companies dictate patient care. And I'm sure that when Ephrata said that, they knew that they wouldn't get paid for that diagnosis unless you were at a 9. And so they couldn't admit you. 8.9 wasn't good enough unless you were bleeding. So, there again, the clinicians are letting a health insurance company dictate care, and that's something that just got to stop. In fact, I wrote a book about it. The book is called Sickened, How the Government Ruined Healthcare and How to Fix It. It's got a 6-step solution on how to fix our healthcare system. It's on Kindle form now, and go to Amazon and download that. Also, this year, it's going to be available on audiobook and on paperback. So stay tuned for that. Carl, thank you for that story. That's